Hello everyone, in this video we are going to discuss about types of claw hand. First is ulnar claw. This is generally seen at rest. When the normal hand is resting on a table, we will see a flexion of fourth and fifth fingers, that is ulnar claw. It is generally seen in distal ulnar nerve injury. It is seen in distal ulnar nerve injury. It is because of the hyperextension of the metacarpophalangeal joints and flexion at the interphalangeal joints of fourth and fifth digits. This is because of the loss of action of the lumbricals. The normal action of lumbricals is flexion at MCP joint and extension at the interphalangeal joints. But this is reversed because of the loss of this action. There will be flexion at the interphalangeal joints, causing the ulnar claw. Next is hand of benediction. Here the normal position will be normally it is normal, but whenever the patient is asked to make a fist, then the patient will not be able to flex these three fingers. First, second and third fingers he will not be able to flex, but the fourth and fifth fingers is normal. It is generally seen in proximal median nerve injury. Inability to flex the first to third digits is hand of benediction. It is seen in proximal median nerve or high median nerve injury. There is paralysis of flexor digitorum superficialis and profundus, so the patient can't flex the digits. Next is median claw. It is seen in distal median nerve injury. So whenever there is wrist laceration or carpal tunnel syndrome, this is seen. So at rest only the patient will have the clawing of these three fingers. This is because loss of lumbricals of second and third digits. You can get a question, why both hand of benediction and median claw, both median nerve is damaged, then why different hand gestures? In high median nerve injury, both flexors and lumbricals are affected, so the patient is unable to flex it. But in low median nerve injury, like in median claw, the flexors are intact but the lumbricals are affected, so there is clawing of the fingers similar to the ulnar claw. Next is, this is the normal OK sign. Whenever we will ask the patient to keep an OK, it is normal. But if the patient is having any anterior interosseous injury, anterior interosseous nerve injury, that is a median nerve, branch of median nerve injury, the patient can't keep this gesture as a normal thing because there will be pinch deformity, weak flexion at the thumb interphalangeal and distal interphalangeal joint. The patient can't be able to keep this gesture because of the flexor pollicis longus to flexor digitorum profundus. This is damaged because of the damage to anterior interosseous nerve. So coming to the other claw hands, ulnar claw is seen in ulnar nerve injury. Hand of benediction is seen in median nerve injury. Total claw hand, whenever these two, ulnar and median nerve, are injured, combine all the clawing of all the fingers, 4 fingers is seen except the thumb. Next, Klumpke's palsy. It is seen in lower brachial plexus damage, in tractional injury or birth or fall. Here, severe claw hand with possible Horner syndrome is seen. So, in just ulnar claw, clawing of fourth and fifth fingers at rest. At resting position only we will see this ulnar claw. On making a fist, ulnar claw will be normal. And coming to hand of benediction, at rest it will be normal. But when making a fist, these fingers will not flex, so there is hand of benediction. In total claw, clawing of all the fingers except the fifth finger. In Klumpke's palsy, clawing of all the fingers. Horner syndrome is seen in Klumpke's palsy. Coming to muscle wasting, hypothenar muscle wasting is seen in ulnar claw, thenar muscle wasting is seen in benediction. Both hypothenar and thenar muscle wasting is seen in total claw, since both ulnar and median nerves are affected.